Hello everyone, Dr. Mike here. Today we're talking about something super important, diabetes. Early detection is key, and you might be surprised to learn that your feet can actually give you early warning signs. We're going to explore 11 foot signs you absolutely can't afford to ignore. So stay tuned, because this information could save your life, or the life of someone you love. Have you noticed that you're getting foot infections more often than usual? This could be a sign of diabetes. High blood sugar can weaken your immune system, making it harder for your body to fight off infections, especially in your feet. Pay close attention to any cuts, sores, or blisters that seem to take a long time to heal, as these could be early signs of trouble. Remember, early detection is key, so if you're experiencing frequent foot infections, it's crucial to consult your doctor. Another important sign to watch out for is swelling in your feet. Diabetes can cause nerve damage and affect blood circulation, leading to fluid buildup in your feet and ankles. This swelling can be painless or uncomfortable, and you might notice that your shoes feel tighter than usual. If you're experiencing persistent foot swelling, it's essential to get it checked out by a healthcare professional. Diabetes can be effectively managed, but early diagnosis and treatment are crucial for preventing complications. Have you noticed any open sores on your feet that are slow to heal? These could be foot ulcers, a serious complication of diabetes. High blood sugar can damage nerves and blood vessels, impairing blood flow to the feet. This makes it harder for your body to heal, leading to these stubborn ulcers. If you spot any, don't hesitate to see your doctor immediately. Changes in the color of your feet can also signal diabetes. You might notice redness, a dusky discoloration, or even a bluish tint. This happens because diabetes can affect blood flow and circulation in the extremities. If your feet are frequently changing color, especially if accompanied by pain or swelling, it's crucial to get checked by a healthcare professional. Numbness or tingling in your feet is another red flag. This is a classic sign of diabetic neuropathy, where high blood sugar damages the nerves in your feet. These sensations can range from a mild pins and needles feeling to a complete loss of sensation. Early detection of neuropathy is vital to prevent further complications, so don't ignore these symptoms. Hey everyone, Dr. Mike here. Let's talk about foot pain. We all experience it from time to time, but for people with diabetes, it can be a red flag. High blood sugar can damage nerves in your feet, leading to a burning or tingling sensation. This is called diabetic neuropathy. If you're experiencing persistent foot pain, don't brush it off. It's crucial to get it checked out. Ever notice your feet feeling unusually cold? For those with diabetes, this could be more than just the temperature. Diabetes can affect blood circulation, particularly in the extremities like your feet. This reduced blood flow can lead to cold feet. It's essential to monitor this, as it can also increase the risk of other complications. So, if you're consistently battling cold feet, it's worth discussing with your doctor. You might not think much about hair loss on your feet, but it can be a sign of diabetes. Remember, diabetes affects blood flow. When your feet don't get enough blood, hair follicles can be deprived of the nutrients they need to grow. This can result in hair loss on your toes and feet. While there are other reasons for hair loss, it's always best to rule out diabetes, especially if you're noticing other symptoms we've discussed. Have you noticed your feet changing shape? Maybe they seem flatter or wider than before. This could be a sign of Charcot foot, a serious condition linked to diabetes. High blood sugar can damage nerves in your feet, making it hard to feel pain. This means you might not realize if you've injured your foot, leading to changes in its structure. If you notice any changes in the shape of your feet, don't hesitate to get it checked out. Hey everyone, Dr. Mike here. We're continuing our look at foot signs you shouldn't ignore, especially if you have diabetes. Dry, cracked skin can be a sign of poor circulation, a common complication of diabetes. When blood flow to your feet is reduced, it can impact your skin's ability to stay hydrated and healthy, leading to cracks that can become infected. Now onto a smelly subject, Unusual foot odors. While everyone's feet can get a little funky sometimes, a persistent foul odor could point to a serious problem like a foot infection. Diabetics are more prone to infections, and foot infections can quickly escalate if not addressed promptly. So, if your feet are giving off an unusual stench, don't just mask it with powders or sprays. Get it checked out by a doctor. That wraps up our 11 foot signs you can't afford to ignore, especially if you're living with diabetes. Remember, your feet are your foundation, and taking care of them is crucial for your overall health. If you notice any of these signs, don't hesitate to reach out to your healthcare provider for advice and treatment. Stay healthy and take care of your feet.